So as far as recent developments go, we have three to share with you in general. Now, first, after a disciplined selection process, a lot of work has gone into this. We've identified several partners with whom to work to provide the GMP manufacturing services, the safety and toxicity studies that will be required by regulators as well, pardon me. Two of these entities are based in the US and one is in Europe. And it's really important to understand that selecting the right partner is critical because they've got to have the right capabilities for what we're going to need now and also probably in a year and 2 years' time at the right price and at the right size. We don't want to get lost in the bureaucracy of a large entity that's so large that we're meaningless to them. We need folks, and we have vetted these parties to be both capable and engaged and entrepreneurial, frankly. And I think we've done a great job on that, and those partnerships are now primed and ready to go. And those are key supplier relationships, obviously. Secondarily, IP protection is critical for the business and critical for the business to capture the economic benefits of the good we expect to create with targeted hyperthermia. We've been very active with counsel on building an IP ring fence around the business as a result. Well, our gold nanorod patent has been granted in one territory. It is still pending in others, but we expect more approvals soon based on the back and forth we've had with investigators. We are also in the midst of filing several other patents, including for our next-gen light device that we've spoken of in the past and will be important in terms of operationalizing targeted hyperthermia therapy in the future. There are other exciting concepts, though, that we're working on, and we'll look forward to be able to tell you about those in the future in the coming months. Now, finally, as far as updates go here, with the Excite International ETR panel insights, we have labeled ETR as Early Technology Review. I'm pleased to report that we held the first of our several 3-hour panel discussions with a group of surgical oncologists and executives from US payer organizations as part of our partnership with Excite International. As some of you may know, Excite, which is a not-for-profit global collaborative initiative, facilitates feedback from experienced practitioners and payers for emerging medical device developers. The purpose of this first session was to introduce the group to our proposed therapy and to have them challenge us and brainstorm with us on the most efficient route to clearance by regulators, to market, and ultimately to adoption by their fellow practitioners. Getting this input up front is critical, as there are plenty of FDA-cleared medical devices sitting on shelves out there that have never succeeded in gaining adoption for a plethora of reasons. Now, while I can't name the individuals on the panel, I did want to give folks a sense of the credibility they bring, and so I here cite the institutions with which they're affiliated. Needless to say, these folks are highly credible, and they were highly engaged in the process. Whether they currently work for a medical school, hospital, or payer organization, all of them are physicians with broad, relevant experience. The good news is, coming out of that first very engaging and interesting session, is that they were very supportive of targeted hyperthermia therapy and all saw the merit in it. The better news is that they challenged us on the best path to approval, questioning both the best indications for use and practical considerations when using an endoscope. And they brainstormed with us on possible enhancements to both. Based on the discussion and on our ongoing research, reflection, various consultations, we'll be reconvening with that group in the coming weeks with a greatly improved protocol and proposition to gain their further insights and guidance and support, to make sure that they have heard, that we have heard their commentary and their guidance to us and incorporated it to make for a stronger proposition for Sona as we move forward for targeted hyperthermia therapy.